Hi, my name is Malcolm Wright. I oversee product management at EQUICARE Health. We've developed a software solution for cancer care coordination called EQUICARE CS. During this brief webinar, I'll provide an overview of the survivorship features in EQUICARE. This is part of a series of webinars that demonstrate the various modules in EQUICARE. So if you want more info after watching this webinar, feel free to watch them on this same website. So I'm going to switch over to my browser now. EQUICARE is a web-based application, so you can use any browser with internet access. I've logged in as a nurse. You can see who I am over here. I have a series of menus which allow me to navigate the software. I've also got a series of actions here which just give me access to some commonly used functions in the software. So to show off our survivorship functionality, I'm going to activate a new patient in the list. I'm going to go to the new patient work list. I'm going to search for a patient with a diagnosis of breast cancer. What the software is doing here is extracting all the patients who've been registered in your oncology information system and with a diagnosis of breast cancer. I'm going to pick Mary here because she was referred to me for survivorship, and I'm going to click on the Set to Active button. What the software is going to do is it's going to walk me through this multi-step wizard with the end goal being the creation of a survivorship care plan for Mary. So on the first screen here, I'm simply activating the patient. I'm identifying who's their care coordinator. By default, that's me. I'm identifying her stage of care, whether that's diagnosis, treatment. In this case, I'll say survivorship. And there's other elements that I can pick as well. I'm going to save that, and now I've fully activated the patient in the system, and the software has pushed me over to the second tab in the workflow, which is all about capturing referrals. The goal with the referrals tab is simply to identify the different sources of referrals within the system for Mary. So I want to capture, for example, that her family physician referred her in for surgery to see Dr. Carter, and perhaps that Dr. Carter in turn referred the patient over to see our medical oncologist, Dr. Fredericks, who in turn referred the patient over to see me in survivorship. And really the goal here is just to identify the full sort of chain of references for this patient as they progress through their cancer care continuum. So I'm going to save that now, and the software is now going to present me with the care team view. What this allows me to do is identify the contact information for all the patient's care providers. The good thing is that this is fully automated in the system. So we've already captured all the contact information, emails, phone numbers, etc. for the different providers, and the software has populated the care team list already. So I'm not really doing anything here other than just ensuring that everything's correct. So I'm going to go on to the next tab, which is the treatment summary. This is a really important tab because the Institute of Medicine recommends that all patients that have had a cancer diagnosis have a full review of their a full overview of their treatment as part of their survivorship care plan. The nice thing about our product is that this is a fully automated process. We're extracting the treatment information automatically from your oncology information systems. So we're pulling the diagnosis, the surgery, the chemo, and the radiotherapy. We're consolidating that information because you may have multiple oncology information systems in your organization. And we're presenting it in an easy-to-read format for patients. We're also keeping this information up to date. As the patient progresses through treatment, additional records are added, and the total dose extends as the patient progresses. Another important element of this is that you have control over what the patient can see in the patient portal. So we can make this a fully automated process where records that come into EQUICARE are visible immediately, or you can make it a fully manual one, whereby the nurse is going in and identifying those elements that they want to publish and make visible to the patient. Next step in the process is to set up the patient's follow-up plan. And here's where we're starting to reference the oncology library of guidelines. So I've picked breast cancer because that's Mary's diagnosis. And what I'm showing here are all the different NCCN follow-up guidelines for a breast cancer patient. And my goal here is to assign those that are appropriate for Mary based on her diagnosis, on her the type of treatment she's had, perhaps on some of her risk factors. So I'm going to just pick the basic breast cancer guidelines. I'm going to identify the start date as today, and I'm going to say I want that to carry on for, let's say, for 10 years. And finally, I also want to identify whether I as a care provider want to get reminders about each of these recommended activities before they happen. So I can choose to do that if I want to be fully engaged in the patient's follow-up management, or I can just say, turn that off and say, my goal here is simply to create a survivorship plan for Mary and nothing further. So when I assign that to the patient, what I've now done is I've created a 10-year plan based on those NCCN guidelines with all the recommended activities described by the NCCN. If, in addition, the patient has other factors like they're on tamoxifen, I might want to merge that into their follow-up plan. So, for example, by doing this, I'm indicating that the patient should also have a pelvic exam every year for 5 years. So I can really tailor the follow-up plan based on the recommended guidelines, and that I can create something that's very specific for this patient very easily. The next step here is to create an education program for the patient. And again, I'm going to reference our library of oncology-specific content. And in this case, what I'm doing is I'm filtering all the oncology-specific topics that relate to the patient's diagnosis, the type of side effects they might have, their late effects, etc. And it's just showing me all the topics in those various areas. And my goal is just to identify which of those topics I want to assign to the patient to become part of their survivorship care plan. So if I sign that, now this information is available to Mary online. It also becomes part of her printed plan, which I'll show you shortly. If the patient's also had a specific type of surgery or a specific chemo agent, I can extend the list of topics and pick from side effects and late effects that relate to those particular issues. The next step here is to set up a questionnaires for the patient. And the goal here is to really give you a vehicle for collecting patient-reported outcomes. So EQUICARE really serves as a tool for delivering, collecting, and reporting on patient-reported outcomes. And again, we're referencing our oncology-specific set of questionnaire templates. So in this case, I'm going to assign a distress causes questionnaire. Maybe I'll give her a quality of life questionnaire. Your organization gets to determine which of these questionnaires are appropriate for which patient. The next step then is to print all this information off. This may seem sort of funny because all the information we've just put together and reviewed is available to the patient online in the patient portal. The reality is that a lot of patients aren't going to have access to a patient portal or won't have the ability to review that information online. So we also want to give them the ability to, or you the ability to print that off and incorporate it into, say, a binder that you're providing to the patient. So here we have a printed care plan that includes a cover letter, a table of contents, a welcome to our program letter, an invitation to the patient portal. All the information you're seeing here can be customized for your organization, so it's all templated. You can see the logos at the top are the institution's logos, but the information contained in it is what you've just tailored to meet this specific patient's needs. So it's a very quick way for you to create a survivorship care plan that's professional, that's comprehensive, and that's tailored to each specific patient. So the last step in this wizard then is to set up reminders for the patient. And the goal here is to provide another way to ensure patient engagement. Obviously, providing them with a survivorship care plan is important. That gives them a clear understanding of what upcoming care is recommended. But this is a way to ensure that they're actually getting email reminders or SMS reminders about those activities before they happen. So you can choose to send emails. You can choose how information is sent to the patient. You can choose when it is sent. The patient also has the ability to set this information from the portal, so they can control what email address information goes to. And when I update that, now I've got the patient fully engaged in their survivorship care. Once I've done that, I've completed a survivorship care plan, And I can feel confident that the software is going to remind both the patient about all these activities and keep them up to date about any upcoming treatment or changes in their treatment. I also can ensure that I, as a care provider, I'm going to be alerted to any sorts of activities that happen, both triggered by the patient completing questionnaires or from the follow-up plan that I've just created. That was a brief demo on how to set up a survivorship care plan in EQUICARE. If you want more information, feel free to visit our website, send us an email, or give us a call. Also, feel free to watch the other webinars in this series, also available from this same webpage.